Have you ever thought why, despite their age, stars and celebrities appear younger and more beautiful? Do you know anyone who has a wrinkled face and is suddenly getting younger and wrinkle-free? Well, the secret behind all of this is Botox. Botox is a drug. It is a brand name of a toxin made by bacterium. Botox is a medical substance that doctors have been using for years to treat wrinkles and facial creases. This drug derives from a bacterium called Clostridium botulinum, and it is injected into specific muscles in order to relax and paralyze them. Hello everyone, today's video will be about Botox injection. Hi there, I'm Queenie from Cloud Hospital TV. Today we'll talk about Botox. What is it and the places where Botox can be used safely and effectively. And before we start, please subscribe to our channel so the next time you'll be updated with our new releases. So what is Botox? Botox injection uses a toxin called botulinum, a toxin to temporarily prevent a muscle from moving. It is the same toxin that causes the life-threatening type of food poisoning called botulism. But doctors use it in small doses to treat health problems, including Botox injection work by weakening or paralyzing certain muscles or blocking certain nerves. Botox is the term you hear most often because it was the first injectable botulinum toxin. There are other brands, such as Dysport and Jawline. How is Botox used? The most common reason doctors use Botox is to reduce the appearance of face wrinkles. Botox is most often used on forehead lines, crow's feet, and frown lines. Unfortunately, Botox won't help with wrinkles caused by sun damage and gravity. But getting a Botox shot can help treat other conditions, such as severe sweating, cervical dystonia, which is a neurological disorder that causes severe neck and shoulder muscle spasm, blinking that you can't control, eyes that point in different directions, and overreactive bladder. Now let's talk about Botox on forehead. Botox injection for the forehead are treatments that are used to smooth horizontal and vertical wrinkles between your eyes that appear typically as a result of frowning. The forehead lines are also known as surprise lines. They become more and more pronounced with age, giving the skin an age aspect. Botox in the forehead can also be used as a preventative measure because if injected in the appropriate places, it can prevent new wrinkles from forming while it is in action. Now, you might ask, how many units are required for forehead Botox? Well, it depends very much on the severity of the lines and the body's response to the toxin. For example, horizontal forehead lines, practitioners can inject up to 15 to 30 units of Botox. Botox between the eyebrows. Botox brow lift is a procedure used to treat frown lines between the eyebrows. It also raises the height of your brows to give you a more relaxed look. Frown lines are also known as glabella lines. They are lines that appear between your eyebrows due to losing skin elasticity as well as genetic inheritance, exposure to sunlight, and smoking. The amount of lift you get will vary, depending on your age and tone of your muscles, that they are left active to pull up the non-relaxed muscles. Also, Botox can be used on the top of the nose. The lines that form on either side of the nose are called bunny lines. They usually appear as a natural consequences of aging. Botox injections are placed at either side of the nose. Nasal Botox is the most painless and quickest method possible in the rhinoplasty methods. Now, Botox under the eyes. The creases or lines that form underneath the eyes can be treated with Botox, but be careful, as the muscle targeted by the Botox injection is the one that is responsible for the movement of the lower eyelid, which means that if the procedure goes wrong, a drop of the lower eyelid could happen. Now, Botox on the lips. Botox injection can enhance the appearance of the upper lip. The Botox lip flip is an intervention designed to use Botox injection to make the lips seem larger. It can minimize lines and creases in the lip area, elevate the corners and mouth to correct gummy smile. This effect achieved by injecting Botox into the upper lip, which causes the muscle to relax, making the lip curl in an upward direction. In this way, the upper lip will seem larger without modifying its volume. Botox jawline. Botulinum toxin is a cosmetic toxin that paralyzes face muscles. Neutral toxin in the masseter muscle can be used in the jaw. When you clamp your teeth down, you will feel a deep prominence along your jawline, which is one of the several muscles that help us chew. Injections of botulinum toxin to this area will act to weaken the masseter muscle. Fortunately, this improves the pain that some people experience in their jaw and also elevate uncomfortable night grounding. Lastly, Botox for the hair. Botox for the hair does not include the active ingredient botulinum toxin, which is the primary component of Botox. Instead, it is a name derived from how the product functions, similarly to how Botox works by relaxing muscles and smoothing skin. Hair Botox works by filling in individual hair fibers to help give it volume and smoothness. Thank you for joining us once again at Cloud Hospital TV. If you have any questions or comments, please leave them below and we will respond to you as soon as possible. Our next topic will be Botox Part 2, so I will see you in the next one.